Welcome to the McMaster Family Health Team, part of the Department of Family Medicine at McMaster University. We offer patients a full range of healthcare services from 3 clinics: McMaster Family Practice and the Maternity Center in downtown Hamilton, and Stonechurch Family Health Center on the mountain. As teaching clinics, we're dedicated to the health and wellness of you and your family throughout your lifetime, as well as providing hands-on training to new family doctors and other healthcare professionals in our community.
And so for patients, what this means is you get access to helping people become the best family medicine specialists that they can be, and as well getting up-to-date care from the most evidence-based guidelines.
By doing their rotations here at McMaster Family Practice, learners really benefit by having a strong team behind them to give them as many opportunities to develop their skills.
Our teams provide care for patients from all stages of life, from birth to end of life, treating both physical and mental health needs. We view each patient as an individual, paying attention to their overall health and wellness. Our approach to care is on the leading edge of family practice in Canada today.
By just treating everyone the same, you might miss things, versus when you really understand everything from their mental, physical, as well as emotional well-being.
When we come to the clinic, I always feel like an individual. I feel that there's lots of time to ask your questions. I never feel hurried, and I feel listened to.
We're committed to improve the practice of family medicine and conduct research to innovate new ways to deliver care. As a patient, you may be asked to take part in our research. Participation is totally voluntary and does not affect your care if you choose not to take part.
There are a lot of research projects and initiatives. One of the most important things is looking at deprescribing, having a role in really taking a good look at the values of the person, as well as the evidence around certain medications and how that has improved care. And we know that we can get people off medications that they don't want and that they can't benefit from.
Our team approach means your care will be overseen by your family physician, supported by a team of qualified resident doctors who have fully completed their medical studies and are training for a specialty in family medicine. We also provide training for undergraduate medical students and other healthcare professionals who you may have contact with as well. Visits may be monitored by live feed cameras and sound for purposes of teaching and quality of care. As part of our team-based model, you may be cared for by various doctors when you visit, as well as other healthcare practitioners. Your team may include nurse practitioners, physiotherapists, social workers, pharmacists, and many more. Our team-based approach to care ensures that you have timely access to the right care at the time that it's needed. Your care may expand to include other in-house consultants, such as psychiatrists, geriatricians, or pain management specialists. Within our clinics, we can assemble a complete team capable of delivering the best possible care to maximize the quality of your life.
I started working here about 10 years ago, and I was used to working on my own, and I would have to write a letter to the family doctor and then wait. Here, it's just wonderful. You know, if the client has a question, it's not part of what I do. I can just zip down the hall and ask. And it means we can really address the whole person.
I've had a lot of challenges through life, with my back being in a walker and then getting back up, but the support that they give you here, it's very, very good.
We offer same-day appointments if possible. Some appointments, including healthy baby visits, may be pre-booked. We suggest calling earlier in the morning for any urgent concerns. Keep in mind, some services may not be offered on certain days due to availability.
I think it's very important to treat patients with dignity and respect because everybody's experiencing something very different in healthcare. Someone could have anxiety or something like cancer, and it's very different to every person, so you have to be very mindful of that.
On weekends, we're open by appointment only from 9 a.m. to 2 p.m. for urgent concerns. This is not a walk-in service. When the office is closed, we are available 24/7 for more urgent medical issues and can provide advice over the phone. We ask our patients not to visit walk-in clinics elsewhere, as we do not have access to records from those visits. Getting to our clinics is easy. There's ample parking at each location, and we're situated within close walking distance from bus stops. Your first appointment will be a simple meet and greet to get to know your new physician. Please bring a valid health card as well as a complete list of any medications you are taking, and a description of existing medical conditions to inform the doctor. We're glad to welcome you to the McMaster Family Health Team. Together we serve, we teach, and we discover, with one purpose in mind: to deliver innovative primary care for better health and a brighter world.